Good afternoon, everyone. The topic for today's class is health education. The contents are introduction, definition, aims and objective, approaches in health education, contents, principles, educational aids used in health education, methods, conclusion, and references. Coming to the introduction, the word education is derived from the Latin word educare and educare, which means to bring out and to lead. So, health education is the process of imparting information about health in such a way that the recipient is motivated to use the information for the protection or advancement of his or own family or community. It is an active learning process which aims at changing the attitude and behavior with respect to health practice. Definition of health is the state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity, which leads to socially and economically productive life given by WHO. Health education, it is the process that informs, motivates, and helps people to adopt and maintain healthy practices and lifestyle, advocate environmental changes as needed to facilitate this goal, and conduct professional training and research to the same end. The objectives of health education are informing people, motivating people, and guiding them into action. The approaches to achieve health, there are four approaches. First is the regulatory approach, in which the ruling body is the government. Service approach, in which services are being provided with the hope that services will be utilized. Health education approach, in which health education is given, and the primary healthcare approach. The contents of health education are human biology, nutrition, hygiene, family care, control of communicable and non-communicable diseases, prevention of accident, and use of health services. The principle of health education, there are 12 principles which we will talk in detail. Creditability, it is the degree to which the message is perceived as trustworthy by the receiver based on facts. Interest, if the topic is interesting to the people, they will listen to it. Participation, it as principle says that we should encourage people to participate in the program. Motivation, they are the fundamental desires of learning, which can be primary or secondary motives. Comprehension, it refers to the level of understanding of the people who receive the health education. Reinforcement refers to repetition. It is not possible to learn new things in a short period, so it is like a booster dose. Learning by doing, it is based upon the Chinese proverb, if I hear, I forget, if I see, I remember, if I do, I know. Known to unknown, so before any health education is given, we should know how much people know, and then new knowledge should be imparted. Setting an example, the health educator should follow what he preaches. Good human relation, the health educator should have personal qualities and should be able to maintain friendly relation with the people. Feedback, for any program to be successful, it is necessary to collect the feedback to make any modifications that are being required. Community leaders, they can be used to reach the people of the community and to convince them about the need of the health education. Coming to the educational aids that are being used for health education, there are three types of the aid that are being used. That is the auditory aid, visual aid, and the combination of the audio visual aid. So auditory aids, which are useful in reproducing any kind of the words. The most commonly used are megaphones, public address systems or microphones, gramophones, tape recorders, radios, and amplifiers. Visual aids, based on the principle of projection, they can be projected or non-projected aids like films, cinemas, film strips, lights, overhead projectors, transparencies, bioscopes, etc. Non-projected aids like blackboards, picture, cartoons, photographs, charts, poster, flip charts, panel board, printed materials, models, pamphlets, etc. And third is the combination of audiovisual aids, which uses both sound and light, which are combined to give a better presentations. Example, television, tape, video cassette players and recorders, motion pictures, cinemas, and multimedia computers. It also includes folk dance, folk songs, puppet shows, and dramas. Coming to the methods in health education, the health education methods are of three types: individual approach, group approach, and mass approach. This we will talk in detail. So individual level, it is one of the most best method, reliable and has long lasting effect. The important advantage is that it is a two-way communication so that the health educator can discuss between the individual and can pursue to change the behavior. The individual also gets an opportunity to ask for doubts. But the main disadvantage is that it will be given only to those persons who come in contact with the health educator. So next is the group level. It includes first is the lecture. It is defined as a carefully prepared presentation of facts organized by the qualified person. The chalk means the visual component. So it has a very important place in the smaller group. And it should be based upon the current topic. It should not include more than 30 people. Next is demonstration, which is a carefully prepared presentation. So in this, the procedure is shown step by step to the audience and we demonstrate things, which it has certain advantages that it will arouse interest in the people, pursuit to adopt the recommended practice and based upon the principle of learning by doing. Group discussion. So group is an aggregation of people who interact face to face. It helps them to freely exchange their ideas and opinions. It should comprise of not less than 6 but not more than 12 people. They're all seated in a circle. There is a group leader who initiates the topic and then the discussion is being done. A recorder is also there who can prepare the report. Panel discussion. In this, there are 4 to 8 persons who are qualified to talk about the topic. They sit and discuss in front of the audience. It comprises of the chairman, moderator, and 4 to 8 speakers. The chairman opens the meeting, welcomes the group, and introduces the panel speakers. He introduces the topic briefly and invites the speakers. So, no specific agenda is there. The main aspects are to invite the audience. Next is symposium. So, it is a series of speeches on a selected topic. Each person or expert presents an aspect of the subject briefly. There is no discussion among the symposium members. So at the end, the audience can ask the questions. Workshop. It is the name given to a novel experiment in education. It consists of series of meetings, usually 4 or more, with emphasis on individual work within the group, with consultants and the resource personnel. So total workshop can be divided into small groups and each group will choose a chairman and recorder. Learning takes place in friendly, happy, and democratic atmosphere. The workshop provides each participant opportunities to improve his effectiveness. Role playing. Role playing or social drama is based on assumption that many values in a situation cannot be expressed in words, and communication can be more effective if it is dramatized. The group members who take part in social drama enact their role as they have observed. The audience is not passive but actively concerned with the drama. The size of the group is thought to be best as 25. So role play is also very useful for the school children. Conferences and seminar. This category contains a large component of the commercialized education programs which are held on regional, national, or state level, range from half day to week in length and can cover a single topic or can be more comprehensive. The last one is the mass approach. So for the mass approach, we have a greater method which will include the televisions, radio, health magazine, health exhibition, health museums, newspapers, press, posters, films, health information booklet, and internet. So these are all the methods of health education. Coming to the conclusion, health education and health promotion have the potential to tackle the underlying determinants of oral health and thereby improve the oral health of all sections of the society. Health education seldom has an immediate direct impact on behavior. It predisposes behavior through changes in knowledge, attitude, belief, value, and perceptions. So, health education is vital to the practice of prevention. It is the channel for reaching the people and altering them to the health services and the resources. So, health education, it is the very important part of the community programs which will help in educating the people and it will help them to improve the oral hygiene, and maintain a healthy lifestyle. The focus of health education is on people and their actions through planning and teamwork. Its goal is to make realistic improvement in the quality of life. So these are the references. Thank you.